Hello, welcome back to another teaching session. Today we're covering aspirin overdose. So I'll talk a little bit about exactly what we're going to do in the next slide. Really, it's going to be a case study that we're going to follow. So I'm going to take someone's example and we're going to talk through the case from start to finish. And along the way, some really important concepts I want to cover. Simplified concepts, which can get complicated, but I think they're worth having a look at. It's going to be going to A-level chemistry, talking about equilibria, talking about acid, and relating it to what's actually happening clinically, what's happening in the hospitals, and also what's practically going on when you're taking care of someone in the hospital. And also going to be interpreting a little bit of blood results, some bit more clinical stuff today. Here's our case study. So we've got John, who's a 65-year-old man. You can see him there clutching his knee, and he's brought into A&E by his husband, and he says that he's got tinnitus, this ringing in his ears. He's got blurry vision, he can't quite see, and he looks a bit unwell, and he's breathing really quickly. So they question him a little bit more. They take a history, and they realise that John's been taking a lot more of his painkiller, aspirin, over the last month because of the wear and tear arthritis, or the osteoarthritis in his knee. We step away from John for a second and let's talk about acid-base homeostasis. When I say acid-base homeostasis, I'm talking about the blood. I'm talking about the level of acidity in the blood. It needs to be very, very, very constant. It needs to hover just about 7.3, just on the alkaline side of the pH scale. And homeostasis just means the process of keeping that measurement within range. You don't want to have too much acid or your blood to be too alkaline. And there's two main organs which control the amount of the acids in your blood. On the left, we've got the lungs, and we'll talk about exactly how the lungs do that in a second. And we have the kidneys. The kidneys, they're kind of like the filter of your body, and they can adjust the amount of acid that's leaving or coming out. And kidneys tend to take longer. Lungs are a bit quicker, but they both work together to make sure we have the same or the right amount of acid. So there's going to be an equilibrium coming up on the screen now. Hopefully it will look a bit familiar from your A-level chemistry, maybe your biology. Let's take this one slowly. So on the left, we start with carbon dioxide and water. That can then be catalyzed by an enzyme called carbonic anhydrase, which is all over the body in all kinds of cells. And it's then catabolized. It's processed to carbonic acid. Carbonic acid can then dissociate to a bicarbonate ion and a hydrogen ion. And of course, the hydrogen ion is what's giving us the acidity. And the role of the carbonic anhydrase there, of the enzyme, just means that that reaction happens very, very quickly. And shifts in the equilibrium happen very quickly. So let's say, for example, that very, very suddenly and very quickly, the carbon dioxide in the blood increases really dramatically. What does that mean? It means that the equilibrium is going to shift. So now we're going to have the carbon dioxide and water, and more of that is now going to become the carbonic acid, of which more is going to dissociate and give us protons. So we can say that carbon dioxide, having too much of it can acidify the blood. Bit of a simplification, but it works for what we're saying, and this is how I would think about something if I was seeing a patient. And there we go. The role of the lungs in the acid-base balance is that here we've got an image of the alveolus, that unit of gas exchange in the lungs, and we've got a little capillary wrapped around the alveolus, and we're seeing gas exchange. So we know that there's ventilation going on, the chest is expanding, the diaphragm is contracting and flattening, and we're getting air moving in and out of the lungs. So we're constantly getting a fresh supply of air down into the alveoli. And carbon dioxide will be diffusing out of the blood into the alveolus or the alveoli, leaving the body. And so we're breathing off carbon dioxide and we're absorbing oxygen from the air. And so if we breathe more quickly, what's going to happen is that we're going to breathe off more carbon dioxide because we've got more gas exchange. And so if you're breathing very, very quickly, that can actually cause your blood to become a little bit alkaline. And the reverse is also true, if you think about it. So if you're breathing too little, then we're not breathing off our carbon dioxide. It's staying in the blood. It's not being exchanged. More carbon dioxide means that if we look at our equilibrium again, it's going to shift everything to the right, and we're going to have more protons, more H+. And that's the role of breathing. So we're now in the emergency department, and a nurse has taken some observations from John, and the nurse is very concerned that John is breathing just very rapidly, very quickly. It's not normal. So you've taken your history and you go and examine John, and you realize that he really is out of breath. So you go and prepare some equipment to take a blood sample from an artery because you're worried about the oxygen level in his blood. And what this sample will allow you to do is get a very, very precise measurement so you can know if he's low on oxygen or what his carbon dioxide is. That image in the top right there, that's the needle that you'd use. It goes into the wrist. Not the most comfortable thing to ever happen, but it is a very common minor procedure. So you do all that, and you also send off a blood sample at the same time because you want to measure the level of aspirin directly in his blood, because that's what you're thinking now. You're thinking, he had a lot of aspirin, he's breathing really quickly, he's not quite himself. Let's send off an aspirin and let's see what that says. So we get the blood result back, and what it shows is that the pH is high, so the blood is a little bit alkaline. The oxygen is high, which we're expecting because he's breathing so quickly, he's getting a lot of oxygen in, but at the same time, he's blowing off a lot of carbon dioxide. A lot of that is leaving his body. And his bicarbonate is normal. And that's just a measure really of the kidneys. We're saying the kidneys aren't doing anything here. We don't have to worry about the kidneys. So looking at our equilibrium again, you can see that because of that really fast breathing, we're losing carbon dioxide, and therefore, because of that equilibrium shift, we're getting less protons, we're getting alkaline blood. So you write in the notes that this man, you think he has a respiratory alkalosis. Respiratory meaning it's caused by the breathing system, and alkalosis, alkaline, and osis meaning process in the blood, so alkaline blood process. All right, so thanks to your efforts, John's going to get admitted to a ward. They're going to put him on close monitoring because they're worried about this man. He seems a bit unwell. We want to keep an eye on him. So a couple hours later, you check the computer system, and you're very happy because you see that the blood result from the lab that you sent off, it's come back, and it confirms your diagnosis. So there is a really high level of aspirin in this man's blood. And one thing you should also know about aspirin is that chemically it's an acid. It's derived from, I think, salicylic acid. So while initially he's breathing so quickly because of this chemical in his blood, which is being detected, he's breathing so quickly that he's actually gone alkaline. But over time, what can happen with aspirin is that the level of acid from the aspirin directly in the blood has built up so much that that's outdoing all of the extra breathing that you've done. So knowing that and being worried about it, you do a second arterial blood reading, and you do see that this man is actually quite acidemic. So acid, and emia meaning presence in the blood. So abnormally high presence of acid in the blood. In the end, it turns out that his level of aspirin is so high that he goes to intensive care and he gets put on this hemodialysis machine, which you can see from the image. It's just basically a big box, and you've got one line that goes into a vein, another line that goes into a vein, and all it basically does is it filters all the blood in your body and returns it back to you. It's a bit like a kidney outside of your body, and it can help get rid of things like aspirin or other bits and bobs. Anyways, 2 days later, John is feeling much better. He's back to himself, no more ringing in his ears, and they start making preparations to send him home because he's sick of the hospital, he's sick of the food, he's not having a great time. All right, this is my last slide, and I just wanted to say some key takeaways. The first one is that just to appreciate the role of homeostasis in health, but also in illness. So they keep us healthy, they keep us balanced in many ways, and when that goes wrong, we get unwell. And as doctors and healthcare professionals, you're thinking about these basic organs, you're thinking about the basic science behind it, the chemistry and the biology, and you're trying to use that to come to a diagnosis. And then from there, you can treat the patient and hopefully make things better. So I hope that was useful, and see you for the next one.